Good evening, I'm Dr. Dana, and my team, Sonus Medical, is developing the next generation digital stethoscope, the Sonus. A telemedicine startup I have launched is currently profitable, and the core of our business is leveraging on technology to improve physician productivity. We achieve this even though I spend 5 minutes per day on my patients. Yes, 5 minutes. Now, contrast this with my time at a home care medical team of doctors and nurses of a voluntary welfare organization caring for home-bound or bed-bound elderly patients. The three main reasons for our patients' admissions into hospitals are bed sores, urinary tract infections, and chest infections. Our nurses can detect and treat the first two conditions, but for chest infections, they usually call me during their patient visits, requesting me to do a house call. Most times, I have to schedule it a few days later just to diagnose and prescribe antibiotics. A lot of time wasted. A service feature I'm having difficulty launching for my telemed patients is the diagnosis and treatment of asthma. Asthma treatment, if started early, can prevent the condition worsening to warrant a visit to the emergency department. Almost always, the parents of asthmatic children have the medications at home. It is just that they do not have the objective signs to know when to start treatment at home or to send the child to the clinic or hospital. In a recent discussion with a respiratory physician at one of Singapore's largest tertiary hospitals, he lamented to me that the EMR system stores lots of patients' data like ECGs, X-rays, MRIs, and CT scans, but they have no baseline respiratory audio data of their patients. Patients with, for example, bronchiectasis usually have baseline respiratory chest signs even when they are well, and these signs worsen when their condition exacerbates. We present to you the Sonus staff. Imagine Sonus staff allows my team of home care nurses to send me audio data in real time so I can diagnose there and then and correct antibiotics to the patients on the same day. Very early infections of the most frail cognitive impaired elderly patients will be picked up by my proprietary feature that none of the other digital stethoscopes have in the market. Imagine Sonus staff provides point-of-care provisional diagnosis to parents of asthmatic children to start intervention, and at the same time send off audio data to the attending physician to add an augmented layer of diagnosis. Imagine Sonus staff provides the respiratory physician baseline audio data of his patients so that the hospital medical team can avoid ordering multiple X-rays or scans just to track disease progression and thus save costs. Singapore's Ministry of Health estimates that by year 2030, healthcare costs will balloon to about $60 billion because of the aging population. If we just corner 1% of homebound, bedbound elderly patients being cared for at home, we can come close to $84 million. Therefore, we are seeking funding of $250,000. This fund will be used to develop and iterate the hardware and software, conduct test-based and clinical trials on inpatients with X-ray confirmed pneumonia using artificial intelligence and machine learning. We are the team to succeed. 3 of our team members are co-founders of healthcare startups. Home care services are in the pipeline of my telemed startup. Another co-founder also launched an AI-focused healthcare workflow startup working with one of Singapore's largest network of elder care centers. We will be the showcases on how Sonus staff will benefit the future-ready healthcare workforce. We will now show you a first prototype of our device and the physician online dashboard interface.